My tooth just fell out, no blood, no pain. Can I still get dry socket?
Welcome. I will do my best to answer your question. I am not a great typist. Be patient and feel free to ask if anything is unclear. Did your tooth actually come out completely, or is there still a hard root fragment in the gum? Has this tooth had a large cavity in it previously? Do you have periodontal disease?
The root came out, don't think it had cavity. Hello, I just need to know if I can drink out of a straw or smoke. This was no help, thanks for stealing my money.
If the entire root came out with the tooth, which is unlikely unless you have severe periodontal disease, there should be no danger of getting a dry socket because the granulation tissue under this tooth has already grown into the socket. A dry socket is nothing but loosening the blood clot out of an extraction socket. Even if you had one, it would heal with no treatment. Without seeing an X-ray of the area, I cannot tell you everything that is going on. Please, I am seeing patients. Can you please be patient?
Sorry, first time using this.
I am sorry, I am a slow typist and I have some emergency patients that I am seeing. Have you ever had a tooth just fall out like this before? Are you positive that there is nothing hard or sharp protruding out of the gum? If in fact the entire root has come out, there should be no danger of drinking through a straw or smoking. Dry sockets occur when there is bare bone exposed, and if your tooth just fell out, the socket was already granulated over with tissue and is protecting the bone.
I am pretty sure that root and all came out. It has been loose for a long time. Just recently my wisdom teeth are pushing through. When I woke up this morning the tooth was just laying in mouth, no blood or pain. Now when I stick my tongue in the hole I don't feel anything in the hole. How can I treat periodontal disease?
The first step in treating periodontal disease is to have an X-ray taken of your mouth, and then if periodontal disease is present, have a good thorough deep cleaning. It is something that you can maintain at home after the calculus is removed from your teeth, but requires more frequent cleanings to halt any future bone loss. The reason that most people lose their teeth is due to untreated periodontal disease. How old are you and when is the last time that your teeth were cleaned?
I am 38. It's been over 10 years since I have been to dentist, but I brush 2 a day and use mouthwash frequently. How would I know if the whole tooth is out? I see the crown and it's about 1 inch long with a V shape on other end. Just worried because I smoke cigarettes and don't want cause more damage or pain. I don't have dental insurance. Just thought it was weird that there was no blood.
My gut feeling is that the tooth broke off and there is still a root remaining in the bone. That is why there is no bleeding and dry socket is not your main concern. Your main concern is infection from the root still in the bone. It is not an expensive procedure to have an X-ray of this tooth and have the root removed. If you wait, you will have to deal with swelling and infection. You will not be able to remove the root yourself. The root is nearly 1.5 inches long.
Okay, thank you. I am going to see if I can get into a dentist.
That would be a good idea. Please supply a rating when you get a chance so that we can maintain good quality control. Sorry for the delayed response. There are just a lot of patients that I need to see and I get backed up sometimes.
No problem, never used this service so I got impatient. Thank you for your help.
You are welcome and good luck.
If you have a health question and want to chat with a doctor now, visit justanswer.com/ythealth.